I'm Dr. Kevin Kaplan from the Jacksonville Orthopaedic Institute and head team physician for the Jacksonville Jaguars. I'm here at the JCA, Jewish Community Alliance, giving a talk about shoulder injuries, shoulder symptoms, and how we treat them. The goal of the talk is to define the basic anatomy of the shoulder, bring it down to a level that patients can understand, and go over the different signs and symptoms of shoulder pain, the different diagnoses that I see in my office, and how I treat them. All right, the rotator cuff. So we talked a little bit about the rotator cuff. This is a little bit more detailed look. A lot of people, when they picture a tendon attaching to the bone, they picture a string coming and attaching to one point. And reality is that the rotator cuff is a very broad insertion, any of the rotator cuff tendons. This is the supraspinatus. So it has this big broad cable attachment, and it has all these other little cables in the middle. So I like to tell my patients that the rotator cuff is very much like a suspension bridge. So there are big cables in the front, here, and one in the back, here, and then all these other little cables in the middle. So some people don't understand, how can I have a rotator cuff tear and if I can still move my arm, if I can still lift my arm? If you think about the way a suspension bridge works, it makes sense. In a suspension bridge, if you were to go out to one of the big suspension bridges in Jacksonville and you were to cut this cable and this cable and this cable, would the bridge collapse? No, because it works through support on both sides and all the different other cables. So you can have little minor tears in the shoulder and still have pretty good function, maybe have a little bit of weakness, a little bit of pain, but you still may function well. And some people can live their whole life, and I always tell patients this, I get a lot of second opinions and, the doctor told me I had a rotator cuff tear and I have to have surgery, I need surgery, but I got full motion, I have full strength, what do you think? Not every rotator cuff tear needs surgery. All right? So I did a study in Los Angeles when I was a fellow, and it was a study based on different rotator cuff repair techniques. And it was an interesting study, I learned a lot, but one of the most interesting things I found about the study, and this was a cadaver study, so I would basically take cadaver specimens, shoulders right and left, to try to match controls, and these were supposed to be patients, obviously, that had donated their bodies to science, that had never had a shoulder issue, never had surgery, never complained about shoulder pain, completely healthy. And I was always amazed at how many of these shoulders that I would go into and find a rotator cuff tear, and they never had a problem. So not every rotator cuff tear needs surgery based on this principle alone. Right? So if you're ever told you have to have surgery for your rotator cuff, that's not true. All right? So always get another opinion. So you have symptoms of shoulder pain and you need more information, come visit us online, joi.net. You can see me at my website, www.kevinkaplanmd.com, to learn more about the shoulder. If you have symptoms that don't go away, pain at night, pain when you lift your arm over your head, clicking, popping, come and see us at JOI. We'll be happy to help.